So before we had an office-based OR, I took all my patients to a outpatient ASC across town, but it was never quite as good as the patient experience of our LASIK patients because we control the entire experience here. To move to an office-based OR was a big transition for me. And my initial concerns were, of course, about safety. We wanted to make sure that moving this to an in-office suite was as safe or safer than going to an ASC. The first thing that I realized is we weren't talking about doing surgery in a clean room. I mean, this was a full OR. The only difference between the OR that we have and the OR that you would find at a Medicare ASC is the terminology around it in terms of safety, protocols, sterility. Everything is just as you would find in any other ASC. It's just how is it credentialed and how are the processes documented. I spent a lot of time looking at published data on in-office OR suite, and I found that there was actually more published data regarding safety in in-office suites than there actually was in ASCs. And we all considered ASC to be normal, but there wasn't as much published data. iOR really helped us with the training. The staff that had never done any intraocular surgery at all was trained completely from top to bottom by iOR on how to do that. We were able to train them to be honestly the best OR team that I've ever worked with. My whole career, I was used to having an anesthesiologist or a nurse anesthetist there providing IV sedation for cataract surgery. And so after talking to people that have been doing this for a while, I tried it myself at the ASC where I was going prior to my in-office suite. And I realized that not only was the sedation adequate with oral or sublingual, but it was actually preferred. The patients were less nervous because you didn't start an IV. They didn't feel like a hospital patient. They felt more comfortable with that lower level of sedation. So I actually prefer it now. And I find it to be a safer and more comfortable way to do the procedure. Setting up a in-office suite to the standards that I felt they needed to be done. Like I said before, it has to be just as good or better than an ASC. So it was very clear to me that in order to do that correctly, I was going to need help. I was going to need professionals that had done this before, that had documented these processes before, that understood what it took to become an accredited in-office suite, and people that could provide training and ongoing compliance support. So for me, it was a no-brainer to use iOR partners because they were the leader in that field.